Hello. Welcome to Group 4's presentation over multiple sclerosis and other demyelinating autoimmune diseases. Our group includes Rachel Irvin, Lexi Cochran, Jennifer Wood, and myself, Kyle Groff. For our project, we chose to create a device that utilizes a synthetic protein. We have created an application that monitors all the body's necessary functions to provide real-time data. The device not only uses the protein, it also tracks the protein, effectively curing multiple sclerosis. MS is a demyelinating autoimmune disease that attacks the central nervous system. It attacks the myelin sheath, that is the insulator of the nerves. Think of it as a piece of wire in your home. The sheath is the rubber coating on the outside of the copper wire. The copper wire is the nerve itself, and once the sheath is damaged, the nerves can then distort the signals to the body. If you think of the central nervous system as a highway of information, the potholes of MS cause the nerve signals to crash. Our device is based on the premise that these tetraspan proteins will absorb the attack of the rogue T cells, thus preventing the autoimmune system from attacking the myelin sheath. Any undamaged protein would repair the myelin sheath. Any excess protein would be eliminated by the body naturally. The problem with our idea is that it's only an idea, and the protein is still in the research and development stage. They are currently developing a finger stick blood test for MS. I believe that advancements in these areas leads to the plausibility of our device. Since there's nothing like this on the market now, our economic and manufacturing models are based on that of an insulin pump. The cost of an insulin pump without insurance is in the range of $4,500 to $6,500. Copays can vary from $5 to as much as half the cost of the device. There is also some maintenance charges on these pumps, and the maintenance dollar estimate could reach as high as $1,500. These prices for the insulin pump are about the same price as just one drug used to treat MS. The additional cost lies in the protein itself. $785 for the insulin. The cost of the production of the protein is unknown, but as with most of the pharmaceutical industry, the company sets the price. Since this device is similar to the insulin pump, those are the companies that we would manufacture our device to. Here are some of the major ones that produce insulin pumps. Roche and Medtronic are both very large companies and probably the most recognizable. These two are also probably the ones that spend the most money on advertising their pumps. The application will monitor and provide real-time data to physicians and the patient. So both could monitor these pieces of data. In addition to that, the patient would be able to manually provide the protein to the body. In addition to the social issue that is stated on the slide, there's also the ethical issue. That is, how much could we charge for the device? We could charge whatever we felt we wanted, and the patients and insurance company would pay that dollar amount. Or we could make it affordable to everyone. I know a few people that have MS, and I can tell you that that is what I would do. I would choose to eradicate a debilitating disease, regardless of profit. And that's the way that I feel that it should be. I personally live with someone who has MS, and I can attest to the effects of multiple sclerosis on her. My wife has problems walking, spasticity in her legs and back. She's had some problems with cognition, and the thing about MS is every symptom varies from person to person. It's dependent on which portion of the brain or spine suffers from the sclerosis. So each case is individual. Patient education comes from individual research, neurologists, pharmacists, and the MS Society. My wife has an entire team of doctors that specialize in diseases like MS to educate us about MS, and our device would be no different. We would utilize pharmacists the way that some large drug companies do. That's one of the differences between the flu and MS is when we go to the doctor, we see a nurse, then we see the pharmacist, then we see the neurologist, and then we see the pharmacist again. The pharmacist is way more involved in education and contact than what you might typically expect. These are some other resources for ways to educate patients about MS and our device. I want to thank you for your time, and we hope you enjoyed our presentation. Our group has spent countless hours researching this idea. We would also be glad to answer any questions that may arise. Thank you, and have a blessed day.